Hello guys, good afternoon. My name is Anang39. I am a student from the Polytechnic Kesehatan, Kemenkes Jayapura, majoring in nursing semester 2. Here I will give material about tuberculosis. TB, tuberculosis, which is also known as TB, is a lung disease caused by the bacteria Mycobacterium tuberculosis. TB will cause symptoms in the form of a cough that lasts longer with more than 3 weeks, usually legume and sometimes bleeding. TB germs not only attack the lungs, but can also attack bones, intestines of gland. This disease is transmitted from spitting spit out TB sufferers when talking, cough, sneezing. This disease is more susceptible to someone with low immunity, such as HIV sufferers. The longer a person interacts with TB sufferers, the higher the risk of contracting. For example, family members who live at home with TB sufferers. In patients with TB that does not cause symptoms, latent TB. TB germs remain in the body. TB germs can develop into active if the person's immune system is weakened. As in AIDS sufferers, however, latent TB is not contagious. As said before, TB transmission is not as easy as the flu. So, you will not get TB if you only shake hands with the TB sufferers. However, there are several groups of people who are more susceptible to contracting this disease, named people who live in dens and slums. 2. Medical staff who are often associated with TB sufferers. 3. Elderly and children. Drugs user and people who are detected to alcohol. Smokers, patients with advanced stage kidney disease, people with weak immunity, such as people with AIDS, diabetes, cancer, and people who are malnourished. Symptoms of tuberculosis. In addition to causing symptoms in the form of a cough that lasts a long time, people with TB will also feel some other symptoms, such as fever, limb, weight loss, no appetite, chest pain, neck sweats. Tuberculosis treatment. TB can be detected through sputum examination. Some other tests that can be done to detect this infection disease are chest X-ray, blood tests, or skin tests. Tuberculosis can be cured if the sufferer is obedient, taking medication according to the doctor prescription. To overcome this disease, patients need to take several types of drugs for quite a long time, at least 6 months. The drug is generally in the form of isoniazid, rifampicin, pyrazinamide, ethambutol. TB treatment requires a long time and costs are not small. Therefore, having health insurance can be a consideration. So, you do not need to mess around with the cost of dependence when seeking treatment later. Prevention of tuberculosis. TB can be prevented by administering a vaccine, which is recommended to be done before the baby is 2 months old. In addition, prevention can also be done by wear a mask when in a crowded place, cover your mouth when sneezing, cough, and logging. Do not expel, blame, or spit carelessly. Okay, thanks for watching my materials. Less and more, I apologize. Thank you also for the lecture Dr. Agus Salim give this a segment. Hopefully can be useful for myself and others.